What are the challenges for Indigenous people with cancers like bile duct cancer?
Cancers related to diet and exercise have been a concern amongst the Haudenosaunee, which are the Iroquois or the Iroquois nations. But we were ourselves refer to our people as the Haudenosaunee or the people of the Longhouse. When we think about cancers and we think about other co-occurring conditions that may affect cancers or GI related um, cases, there's three things to think about. One, is it obesity related? Secondly, is it related to alcohol or substance abuse? And the third thing to be aware of are the relationships to hepatitis C. We always hear that, and historically, alcohol has been an issue with indigenous communities for as a form that was used as a gift after treaty relationships, for example. It has deep historical roots and politics. It has a lot of things that have, caused some issues for many indigenous peoples. And so there's that kind of understanding that history that isn't part of our way of life, but has had influence on us, along with things like boarding schools and the area of truth and reconciliation from a Canadian context and now moving into this U.S. context and in the world level through the United Nations Declaration of Indigenous Rights and Health and Wellness, looking at what had happened historically and how some of those things have jointly combined to the health and wellness of Indigenous peoples today. So there's a lot of background to understanding. It isn't just you come to the hospital and, hey, look, there's a case of a GI related cancer or a GI related disease. Also have to understand when the person, the family, and the community, and also the history of the country that we are living in from the past to the present. All those things are combined, should be looked at collectively when addressing patient care.
How has historical relocation to reservations impacted lifestyle?
Because we were relocated, many were of our nations, not so much the Haudenosaunee, but other native indigenous people from across the U.S. and Canada may have been relocated to areas and put on a reserve or a reservation where there's not well, you can't hunt here anymore. This isn't you're for generations you've always hunted this land, and now you have to stay in this 15-mile or 15-kilometer square tract, and you can only hunt here, and maybe the game isn't there, the fish aren't there. So then the introduction of these foods, like fry bread, which is it's like contemporary indigenous food, but it's not traditional. It's not a historical staple of our way of life. It tastes good, yeah, but it's not healthy for us.
How can science and medicine help Indigenous people?
A lot of the parameters in science are often based on non-indigenous or non-BIPOC related populations, and the medicines that are created, the surgical techniques that are created, and basically the medical nuances may be geared for a non-Hispanic white population, for example, which is a greater norm of the conversation in clinical trials and outcomes. So how do we contribute to that in the science? One is to understand, be part of the science at the lead of our native nations, at the lead of our sovereign nations, if they have interests, so that we're not left out in medical advancements.